be helpful to Deputy Kelly. I think one answer to how we deal with the vaccination rollout is to have our public health teams at the level that are capable. Yeah. And because they're the people who deliver immunisation programmes. And as I mentioned to the Taoiseach earlier on, they're taking industrial action. At a time when they have never proven more their value to our society, they're being forced to take industrial action because we have shown them zero respect in terms of their status and giving them status as consultant specialists, but also in the fact that we have a 1/3 of the public health staffing complement of that's recommended. How on earth are you supposed to deliver a vaccination programme as well as the contact tracing and testing that's necessary? And that, to my mind, is sort of indicative of the wider need for coordination, where the left hand knows what the right hand is doing and have joined up priorities. I mean, to give you another example, which I mentioned to you last week, graduate entry medical students, at a time when we need desperately to get more doctors, for example, for our public health teams, I met with last week, and they are paying €15,000 in fees. They cannot manage it and are all saying we may have to drop out and so on, right? Major financial difficulties when we should be assisting them qualifying so that we have more doctors. Similarly with the student nurses and midwives that and the Taoiseach didn't really respond to this. When I met with several hundred of them in an online meeting last week, one after the other, the student nurses and midwives who we need and have been holding together the front line said, I wouldn't work for the HSE once I'm qualified in a blue fit because they're treating us so badly. I'm leaving as soon as I'm qualified. We are hemorrhaging the nurses, the midwives and the doctors that we need because we are treating them so badly. So when will there be joined up thinking where there's a moment of enlightenment where we face a pandemic where it becomes obvious we need more health professionals, more doctors, more nurses and more midwives, and that we would join up our thinking to say, shouldn't we stop putting obstacles in the way of these people actually training, being educated, completing their education, and then actually wanting to work in our public health services? That's the sort of coordination that I think Taoiseach is very sadly missing at a time we need it most.
I already said to Deputy Boyd Barrett that the Minister for Health, Stephen Donnelly, is in office about 5 months, has secured significant resources to transform public health. And that is known, and the funding has been secured. He announced plans in September to double the workforce in public health. It's currently at about 254 people. The plan is to double that. The hiring process has already begun. The Minister for Health, the Department and the Government have been very clear in their support for the creation of consultant posts in public health medicine. And in my view, I don't agree that now is the time for strike action in the middle of a global pandemic. And I believe this issue can be resolved through ongoing talks and engagement between the IMO under the Public Stability Service Agreement. That's the forum for resolving these issues. The creation of consultant-level posts and roles in public health medicine is a priority for the Government. We're fully committed to delivering on that. Now, obviously, there's a lot of detailed work goes into that, and everybody knows that in terms of, and the HSE put a substantial amount of work into it. The Department of Health have a detailed framework for the future public health model that includes consultant-level roles has actually been developed by the Department of Health. The business plan as the case has been seeking consultant status has been submitted only last week to the Department of Public Expenditure and Reform for consideration. And that then would be the basis for the engagement with the IMO on the matter. People in the public health arena are aware of this, that kind of progress has been made. But there is a process here that has to be followed. We believe in the consultant role. How all that works out and how it's, how people apply for that, the roles and the posts that will be created, is kind of detail that needs to be worked out with all concerned. In relation to Deputy MacDonald's questions, and I think we dealt with this again last week, I agree in terms of the need to provide additional resources for more refuge places and to deal with on a coordinated basis with domestic violence. I think Minister McEntee has been proactive in this regard, remains proactive in this regard, and is committed to expanding services and also dealing with issues that have arisen and have been brought to her attention.